Guys, what is depression is? Depression is classified as a mood disorder and also a serious medical illness. It may be described as a feeling of sadness, anger, loss, and also lost interest of something. It also affects to how they feel, how they act, and how they think. So, someone who is experienced of depression must get a treatment, a proper treatment for this illness. Because if you not get a proper treatment for this illness, it will be getting worse. So, someone who is experienced it must get a proper treatment to this serious illness.
Do you think you might be depression? There are a lot of signs of depression, such as anxiety, speaking more slowly than usual, but sometimes you may not have them all. Depression varies from person to person, but there are some common symptoms. For your information, each anxiety symptoms might be totally different from someone else. Depression and anxiety can occur at the same time, but anxiety can happen when your body's natural response to stress. Sometimes you have signs of depression, but you don't know, such as moving or speaking more slowly than usual. Depression also can change how you think and function in your daily activities. For example, if you know how to drive a car and you're driving to a parent's house, it's an executive thinking task because you're planning where to go or mapping route. But if you have depression, you may have slower executive thinking, processing speed. So it is more difficult when you drive to a location and your thinking is also slow if you have depression. The other symptom of depression is a worry about something happen today and the future or hopeless outlook. For example, when a person grieves for a long and they try to cover the sadness with a smile, they will feel losing hope to continue living and ending their own life. This is a way for some of people to escape pain or suffering.
Hi, Assalamualaikum. Today I would like to explain about the cause of depression. The cause of depression are due to personality disorder. Each individual has he or her own personality trait. Individuals who suffer depression will have intense sadness, inactivity. They feel like sleeping all the time. They lost interest in doing everything and feel helpless about themselves. This leads to them feel depression and mental distress. Okay, next. Depression caused by the use of drug and alcohol. Individuals affected by these symptoms are usually prone to sudden emotional changes. People who take drug and alcohol suffer personality issues, including interpersonal relationship difficulty, as well as an inability to control excess emotional condition lead them to suffer mental health problems and depression. Finally, the last reason is due to family history. Experience from poor family history are more likely to have mental health problems, such as being abused and victimization by their own family member, and a few of them expressing in a situation where both of parents were fighting between each other, and I sure that they will suffer from mental health disorder or most likely called depression. That's all. Thank you.
Hello everyone, my name is Shilana, and today what I'm gonna to introduce is the types of depression. The term depression encompasses so many types of depression. Here, I will merely explain 3 types, which can help you begin the journey of diagnosis. The first one is the bipolar disorder. The exact cause of bipolar disorder is unknown. Experts believe there are a number of factors that work together to make a person more likely to develop it. Individuals who experience bipolar disorder experience periods of high energy and then feel very low and depressed. Second one is the seasonal affective disorder. As the name suggests, it is characterized by changes in mood as seasons change. Symptoms often begin in the fall. As days start to get shorter and continue through the winter, patients are more likely to have symptoms of social withdrawal, anxiety, and sleepiness increase significantly. Daily feelings of sadness, hopelessness, or uneasiness will also flow in their hearts. The last one is postpartum depression. It is a mood disorder that can affect nearly 1 in 7 mothers after childbirth. Mothers with postpartum depression experience feelings of extreme sadness, anxiety, and isolation that may make it difficult for them to complete daily care activities for themselves or others. If you feel you or your friends fit the characteristics of depression, please go to the hospital for more professional consultation as soon as possible. Thank you.
Hello everyone, my name is Tintin. I will introduce some methods on how to cure depression. The first method is medication. It is the main treatment for depression. It should be not that psychoactive drugs should be taken under the guidance of the doctor and strictly by the doctor's advice. Currently, the clinically recommended antidepressants include SSRIs, SNRIs, NDRIs, and so on. Secondly, physical therapy. Clinically, MECT and RTMS can also be combined with treatments. The therapy among them, MECT can quickly and effectively treat the depression. The treatment has a clear effect and can control symptoms quickly. It is especially important for patients with severe depression, such as suicide, refusal to eat, or suicide. The third method is psychotherapy. Psychotherapy mainly refers to treatment by talking or communicating with doctor. It is often combined with medication. If you find that you have depression through the test, please don't be afraid to worry, but believe that through scientific treatment and biological communication, you can be greatly cured until you fully recover. Finally, I want to say to patients with depression, before life reaches the way you want it, you have to allow it to accumulate. From depression to recovery is also a process of reshaping life and gaining freedom of the thought. This is a long process. You will take a lot of medicine, go to fitness, swim, and so on. You can catch this opportunity, take a break, and that you'll have a conversation with your heart. So thank you.